Hello, my name is Nunez. I'm going to be giving my IM injection checkoff. And to begin, I'm going to be doing my patient's prescription, and I'm going to ensure that there is a prescription for this patient, and I'm going to identify any potential allergies beforehand. So I have Anna Pawlowski, born 5/5/1957. She's 63 years old. And I have located that she does have an influenza vaccine order prescription. The dose is going to be 0.5 mLs given once to prevent the flu via the IM route. Start date 5/11/2020, 14:58. And yeah, so I've done that. I've identified that. So now I'm going to knock on the door, enter the room, phone in. Hello, my name is Nunez. I'm going to be doing your injection today. Can we start off with your full name and date of birth? So she'll say Anna Pawlowski, 5/5/1957. And I'm going to compare that to the chart, which she has on her band, 2 identifiers. And then I'm going to ask her if she has any allergies. She'll say, yes, I'm allergic to penicillin. I see that on her band it also says she's allergic to penicillin. I will compare that to the chart. So today we're going to be doing your, assess scene safety first after I do my 2 identifiers and everything. So bed's in the lowest position, brakes are locked, the call light is within reach, there is nothing on the floor, no clutter. I'm going to clear it if there is clutter. And now I'm going to provide patient teaching in regards to this. I'm going to close the privacy curtain. So I'll inform her that today we're going to be giving your influenza vaccine. It is going to be 0.5 mLs of the influenza vaccine. To start, some nursing considerations. This is my med sheet. I'm going to know that this medication is working if she does not develop the flu. I will also want to ensure that I tell her about the side effects, which is headache, malaise, and pain. I'm gonna watch my patient for any signs of allergies to the medication, and I'm gonna explain the purpose of the vaccine. So the purpose of this is to produce antibodies against the infection of the flu, and it's just basically to prevent the from flu contraction. Okay, so I'm gonna set that aside. Okay, I will ensure that my patient is in a comfortable position. I will answer any questions that they may have. Do you have any questions regarding what we're going to be doing today? No? Okay, so I'm going to now I would gather my medication and supplies. So I did my I'm going to do my 6 rights, and so I will ensure on the order again. I haven't left the patient's room yet, so I'm going to ensure that she has, for Anna Pawlowski, the influenza vaccine, 0.5 mLs via the IM route on 5/11/2020 at 14:58. So I have the right dose, 0.5 mLs. I have the right route, IM, the right date, 5/11/2020, the right time, 14:58. And then I have Anna Pawlowski. So Anna Pawlowski, vaccine, dose, route, date, and time. Okay. So now I'm going to go and gather my supplies. So I will pull the medication. So I have penicillin. We do not want to give her penicillin. She is allergic to that. So we want to give her the flu vaccine like it was ordered. So I'm going to compare it against the MAR now. Again, this is going to be my 2nd check. So I'm going to foam into the med room first. Right. So I have my medication. Pull it. All right. So we have the flu vaccine for Anna Pawlowski. It is not expired. I have 0.5 mLs, which is the dose. I have the IM route. I have the start date, which is 5/11/2020, and it will be administered at 14:58. 8. So that would be my second check. Okay. So in doing that, I'm going to gather my supplies. So I have my medication here. I have my syringe. I have a prior label on. I have my syringe. It'll be 2 to 3 mLs. And the reason for that would be to ensure that the IM, or it's going to be 2 to 3 mLs for the syringe, and it's ordered for 0.5 mLs, so this would be okay. I have a 1 to 1.5 inch syringe, and the gauge will be 21 to 23. When I do this, I'm going to ensure that I will draw 0.5, but I'm still gathering my supplies, so I will inform you of that. So to begin, I have my my alcohol, well, my unused alcohol pad, prep pad. I have my gloves. I have, well, it's not really a supply that I would verbalize, but I have my patient. I have my sanitizer. I have my label, my pen, gauze in case there is bleeding, and then, yeah. So, let's see. Is there anything else? No. Okay, so I ensured my second time doing my 6 rights. So now I'm actually going to do my medication. So when I do this, I'm going to ensure that I do a well, bear with me. Before I do that, I'm going to cleanse the top of the vial for 30 seconds. This is like my 5th time doing it. I've had so many people interrupt. I'm talking to myself. Anyway, so I'm gonna rub the top of the vial for 30 seconds. So we will say that that is 30 seconds. I'm gonna leave this on the top to ensure that nothing contaminates with it. All right. So next up, I'm going to pull this apart with a rainbow method. Doing that ensures that I do not poke myself, or I do not contaminate the tip with any of this other surface. I'm gonna leave the cap on the end of the table so that if I have to recap, I can. I'm gonna remove the top prep alcohol pad. Okay. I'm going to draw 0.5 mLs of air because that is what I'm gonna be putting into the syringe. Okay. So like a dart, I'm going to insert, and I'm going to ensure that the needle does not go into the medication. I'm going to insert 0.5 mLs of air. Okay, flip it over, and I do not want to touch the inside portion of the plunger. That will create a septic syringe. So with using aseptic technique, I'm just going to touch the end and draw 0.5 mLs or more of the medication. The reason I can do a little more is because I want to ensure that I do not have any bubbles. If you do have bubbles, you're going to want to flick that. Flick it to the top. Let's see. All right. So, without touching anything, on the inside, I'm going to ensure that I have exactly 0.5 mLs of the medication, which I do. Flip that back over. Remove. Right. So now I'm going to take my syringe and, using the scoop method on the side of the table, ensure that I pick up the syringe without touching and cap it. So now that it is capped, I'm going to want to label my medication. So you're going to want to label it with patient name. So Anna Plawowski. My initials, JN. Medication, which is the influenza vaccine. Okay. The date. The time. always the hardest part, is not to rip it. Okay, I'm going to stick this onto the label. Okay, so that is on there. So now, re-entering the room with all the medication that I have, I'm going to foam in again. Okay. I'm going to confirm my patient with 2 identifiers again. So Anna Pawlowski, I'll ask name, date of birth. Anna Pawlowski, 5/5/1957. Compared to the MAR, 2 identifiers. Do you have any allergies I need to be aware of? Penicillin. Okay. Can confirm you are allergic to penicillin. Before we begin, do you need to use the restroom? Anything like that. Scene is safe. Once again, no clutter in the area. We already cleared that. And provide patient privacy again. So now I'm going to be doing I'm going to verbalize the proper areas for the IM injection. So you have the deltoid, you have the vastus lateralis, which is right here, which is basically like on the side, and then you have the ventral gluteal, which is back here. And you want to be careful with the rear area because you do not want to hit the sciatic nerve. So yeah, so we have identified landmarks and we can palpate for proper area. So I palpated that the deltoid is probably the best area to administer this medication. So in doing so, I am now going to don gloves. Don gloves, and then we're going to do our 3rd check. Okay. And these gloves are for our protection because we could come in contact with bodily fluids. So that they do not need to be sterile gloves. All right, so we're going to be doing our final check at the bedside. So I have Anna Pawlowski for the medication, influenza vaccine, 0.5 mLs via IM, start date 5/11/2020 at 14:58, and in this case we would begin by scanning the medication, and then scanning the medication chart, or scanning the band, and it'll pop up on the chart, and we're going to tell them or state that we are going to be beginning. So now, if this is the deltoid, I'm going to be starting right here at the end, and then using almost like a triangle method. We're free anywhere in this area, okay? So if this was the arm, I'm gonna be sanitizing with a clean, with a brand new alcohol pad, and I'm gonna be doing in circular motions from least contaminated to most contaminated, outward in a circular motion for 30 seconds. So that is 30 seconds. Now I'm going to leave the alcohol pad pointing to the area in which is ready to be administered. So next, I'm going to be using the Z method, and I'm going to pull the skin as much as I can to create as least resistance as I can. So I have that pulled. Well, I'll once again use the rainbow method to take off the syringe. I'm going to pull and go on at a 90-degree angle. I'm ensuring that I'm not pinching, I am pulling, and I'm going to do it in up to 5 seconds, slowly. So that has been removed. So now I'm gonna let go, and the skin should close, allowing the muscle to almost seal. In this case, I'm gonna recap my my syringe to dispose of it, because I do not want to engage my safety thing as of yet, because we want to reuse these needles in nursing school, not in real life. It sounds so bad out of context. So I'm gonna recap it, clamp it shut. Okay, and I would usually dispose of it in a sharps container. So this has been disposed. I'm going to remove my gloves. Well, before I remove my gloves, if there's any bleeding, I'm going to want to apply pressure with the gauze that I may have. And then if there is more bleeding, or if there is bleeding, I can always apply a Band-Aid afterward. I've applied pressure, removed it, throw it in the biohazard container, and I'm going to apply a Band-Aid, and then I can remove my gloves. So once I remove my gloves, I'm going to want to document that I have finished administering the medication. And then I'm going to dispose of my materials and ensure that the scene is safe, that the patient is comfortable, call light is within reach, bed's in the lowest position, brakes are locked, side rails are up. I'm going to open up the curtain again. I'm going to dispose of everything, foam out, and then leave the room. I hope that is everything that I have covered, and thank you.